This is a normal fetal echo in a late third trimester fetus. Here we study two important views in the study of the fetal heart. One of the most basic views of the fetal heart is the four-chamber view. Here we can see the right atrium and the left atrium, the right ventricle and the left ventricle. The foramen ovale is seen in the septum between the right atrium and the left atrium. The foramen ovale is a natural shunt by which oxygenated blood from the placenta reaches the ductus venosus, and from there it reaches the right atrium and bypasses the right ventricle to directly enter the left atrium via the foramen ovale. This ensures that vital structures such as the fetal brain receive maximum oxygenated blood from the placenta. The foramen ovale closes and seals the interatrial septum within a few months after birth. This flow from the right atrium to the left atrium across the foramen ovale is better appreciated on a four-chamber view in color Dopplers. Thus, here we can see blood flowing from the right atrium to the left atrium across the foramen ovale. This is seen in blue color due to flow away from the transducer. This oxygenated blood from the placenta via the right atrium to the left atrium via the foramen ovale reaches the left ventricle, and from there through the aorta reaches directly to the fetal brain. This shunt called the foramen ovale allows the blood to bypass the right ventricle and the immature non-functioning fetal lungs. This patent foramen ovale in the fetus must be distinguished from an interatrial septal defect, which is abnormal. We should also look for flow across the tricuspid and the mitral valves to see if these valves function normally. The interventricular septum should also be studied to look for any interventricular septal defects. In this case, the ventricular septum appears intact with no flow across the ventricular septum. The four basic views while doing a fetal echo are the four-chamber view, the three-vessel view, and the right ventricular outflow tract and the left ventricular outflow tract. Here we can see a three-vessel view showing the superior vena cava, the aorta, and the pulmonary artery from right to left. All these three vessels show normal caliber and normal function.